Hello and welcome to this video. My name is Dr Jonathan Iliff. I'm an F1 working in a range of different specialties, including psychiatry, in my junior foundation year. And in this video, what I wanted to do was explain something a little bit about antidepressants and their side effects. I've done a psychiatry placement and intend to go into psychiatry later on in my career. But this is really important, whoever you are, whatever specialty you're in, because antidepressants are so common, and as well as mental health conditions being so common. So you'll see them on the prescription pads, you'll have to think about them, their interactions, their side effects, and all sorts of things throughout your career, without doubt. So listen up and let's talk through antidepressants and their side effects. So the first thing to say is that antidepressants are incredibly common drugs. They've been around with us for an incredibly long time, well over 30 years. They are the mainstay of treatment in low mood and in mood disorders in general, such as depression, but also anxiety and so on. And in particular, when we talk about antidepressants in this sense and their 30-year history, we really mean SSRIs, the first one being Prozac, or fluoxetine, as we would more commonly use it, using the generic name in Britain today. And fluoxetine was invented in 78, I believe, and since then it's really taken the world by storm. SSRIs are vastly prescribed, and some would argue overprescribed. We'll come to some of those concerns about the use of antidepressants in a minute, but the first thing to say is that there are other classes, of course, besides fluoxetine and its brothers and sisters like citalopram, escitalopram and sertraline, as well as many others. For example, tricyclic antidepressants. These are less used, as we'll see, because of concerns about overdose, but they are very, very effective and are used with some regularity, especially when SSRI, selective serotonin reuptake inhibitors, as they're called, which describes their mechanism of action, when they fail. And examples of this include amitriptyline, which is probably the most successful tricyclic antidepressant, but there's lots of others, imipramine and so on. And they're very good also for chronic pain as well, neuropathic pain and the like, and so you will see them widely prescribed. But there's something to be aware of and be careful of. So, as I mentioned earlier, there have been some global concerns about the use of antidepressants, and particularly whether they work, which is an important question for all medications, of course, and their overprescription. And the first thing to say is that they do work, absolutely. We've had an astounding array, one that would never normally be asked for in any other kind of medication, in more general medicine, I suspect, of meta-analyses over the last 10 years, the most recent in 2017, a vast analysis showing rather categorically, again, that antidepressants work, and they work really well, not for every patient, like most medications, but they work really remarkably well for a significant number, and this reflects what most psychiatrists and mental health care professionals see in their professional practice, people benefiting and so on. One thing that is worth saying, though, is that there are concerns about the overprescriptions of antidepressants, SSRIs in particular, and this really reflects that there is a lack of talking therapy available, especially on the NHS in Britain, but more generally in the world. And SSRIs are handed out as a kind of stopgap, a better than nothing approach to the treatment of very common disorders like depression and anxiety. This is fine, but actually when we look at the evidence, while there's really good evidence for SSRIs in moderate and severe and life-threatening depression, for example, actually there's not a lot of evidence for it in people who are have only mild depression. And so we need to avoid giving it out when actually it's unlikely to be of a huge amount of benefit, and where other measures like low intensity psychological therapies might be more appropriate, CBT, lifestyle changes and the like. So the meat of this particular video and podcast is the other kind of bête noire of psychiatrists and patients using antidepressants, and that is the side effects. The side effects of antidepressants is an incredibly long list, partly because they're so used and they've been used for so long, and they're so well studied as a result. So common side effects are ones common to a lot of other drugs, things like headaches, nausea. They can also see problems with sleep, changes in kind of cognition, agitation, for example, because of the kind of stimulatory effects that they produce. Although this is, of course, quite mild. Stomach upset and the like. They also have, these are the common and most commonly seen side effects. Things like dry mouth can be added to that list. But in addition, we also have the dangerous side effects. And this is a useful way of thinking of any side effect profile: is what's common and what's dangerous. What is likely to happen to this person, and what do I as a clinician and they need to be wary of to avoid worst case scenarios. And so with antidepressants, there are a few kind of worst case scenarios, although all of them are very rare and of relatively low risk, except perhaps for one. And the first one being a long QT. So with drugs like citalopram, with escitalopram in particular, they produce a long QT interval on the ECG, and this can lead ultimately, in rare cases, to really unfortunate consequences. Things like torsades de pointe, and also to ventricular fibrillation and ultimately death. So we need to be aware when we're prescribing these drugs of other drugs that could be causing a long QT, such as antipsychotics, such as antibiotics that can cause it, and also of long QT syndromes, although these are quite rare and actually drugs are going to be the main cause that you're looking out for. So what else is of concern? Well, another important one is bleeds in the gut. Antidepressants, SSRIs, can increase the propensity of bleeding in the gut, which is a very common problem generally. And so you need to look for other drugs in particular that can exacerbate this, and also for history that hints at this being a problem. So if they're on warfarin, if they're on NSAIDs, things like this, you need to think carefully about your choice of antidepressant, think about whether it's appropriate, and so on. So another oft-cited side effect of antidepressants that you should be somewhat dubious of is the idea that there's an increase in suicide in the 2 weeks after they start being prescribed. There's a lot of uncertainty about the reality of this fact, of this, and whether it's actually based in clear data. The suggestion is that it's because people become, when they are treated for their depression, in the first 2 weeks they become energized, they are able to then act on the suicidal ideations which prompted the crisis or whatever, that then prompted them getting proper treatment. And this may be the case, it may not. Ultimately, it's a kind of retrospective explanation, I suspect, of a phenomenon which is actually more anecdotal than evidence-based, but it's something to keep in mind. And certainly with younger people, it may well be a more solid piece of evidence. So I think the other thing to add also is just to say that perhaps the real danger with antidepressants is not so much with SSRIs, although they can cause serotonin syndrome when taken in overdose, but it's tricyclic antidepressants. These might be prescribed for chronic pain conditions. They might be prescribed as a kind of third or fourth line for depression or anxiety. But tricyclic antidepressants are dangerous in overdose. They really are. They produce a rather nasty set of symptoms, and you need to look out for them and minimize their prescription where possible to avoid people, especially people who are potentially suicidal, having the opportunity, having the mechanism by which they may then attempt suicide. Okay, so I think that is a pretty whistle-stop tour, but fairly comprehensive, of antidepressants and their side effects. We haven't touched on mechanisms and the like, but you've got all you need to know to get out on the wards and really tackle this issue. I think the last thing to say is that this is an evolving field. Besides tricyclics, besides the ancient MAOIs and SSRIs in the modern day, there are new classes of novel psychoactive drugs that will soon and are currently becoming the antidepressants that we are using now and in the future. Things like ketamine and even in short order I suspect things like psilocybin will becoming fairly commonplace over the next 10 to 15 years in the treatment of depression across the world. So thank you very much for listening. I hope that you've enjoyed this video. I've enjoyed making it, and I look forward to hearing from you, and I hope that you enjoy yourself on the wards, and take care. Goodbye.